Hi, I'm Joe Devin, a nurse practitioner with the Cozad Community Health System. We wanted to talk to you today just real briefly about what we're doing to prepare for the COVID-19 virus and what you can do at home to help keep yourself safe. First of all, we wanted to let everyone know that we've been working really hard to prepare for this virus, and we've been working for a while now. We've got some processes in place to help keep people well and to isolate sick people. We also wanted people to know that we do have the ability to test for the virus in Cozad. The testing is somewhat limited at this point, but we're working really hard to ramp that up, and we hope to be able to test a lot of people very soon. We have tested people in the community currently, and we don't have any results back for those tests, but if we have any positives, we'll make sure to let people know. Finally, we just wanted to let people know we do have adequate personal protective equipment at this time to protect the staff that provide your health care for you. And we're working really hard to keep people safe. Next, we wanted to talk to you about what you can do at home to keep yourself and your family safe. The virus is in Nebraska, it's community spread, and it's just a matter of time before it reaches our region and our town. The best tool that we have is social distancing. It's very important that you take steps to keep yourself away from others that might be infected and to distance yourself from others just in general. Second is self-isolation. If you develop symptoms, we want you to isolate yourself so you don't spread those to others. There's 4 key things that we're looking for: a temperature of 100.4 or higher, a cough, shortness of breath, or a sore throat. Any of those things in isolation or in combination, and you should be self-isolating yourself. Finally, travelers are at particular risk. That means international or domestic travelers. If you've traveled, you should follow all the same rules as everyone else with social distancing, but monitor your symptoms, and if you develop any of those symptoms we discussed, fever, shortness of breath, cough, or sore throat, a traveler should notify their healthcare provider and immediately self-isolate. Finally, we want people to know when they can end their self-isolation if they have to do it. The current guidelines are that you should end your self-isolation after 7 days from your symptoms first starting and 3 days with no fever and no cough. So once again, 7 days from onset of symptoms and 3 days with no fever and no cough. We at the Cozad Community Health Systems are working very hard to prepare for the arrival of COVID-19. I personally have a son with asthma and many other family members that fit into the most risky groups. Please help our system and me and yourselves to keep these at-risk individuals safe. We'll keep you informed with the latest information as we get it, so please continue to watch this space and we'll share that information as it arrives. Thank you for your time. Stay safe.